Hi, my name is Leah Love, and I'm a nurse practitioner student at Auburn University. My drug class are the 5HT3 receptor antagonists. Currently, there are 4 approved by the FDA for use in the United States. Ondansetron, which of course is Zofran, is the most commonly used of this class. Granisetron, Dilasetron, and Planasetron. The action of this class are the management of nausea and vomiting by blocking serotonin receptor sites. The therapeutic effect is the treatment and or prevention of chemotherapy-induced radiation and postoperative nausea and vomiting. The pharmacodynamics of this drug are that it blocks serotonin receptor sites peripherally on the gastrointestinal vagal nerve terminals as well as centrally in the chemoreceptor trigger zone. The pharmacokinetics of the 5HT3 receptor antagonists are 75% of this drug is absorbed by the liver. It's also metabolized by the liver. So we want to use cautiously in patients with severe liver impairment. These drugs are excreted in the kidneys. The pharmacotherapeutics. The precautions, we want to use caution in patients with a history of cardiac disease, prolonged QTs, or arrhythmias. Patients that are currently taking SSRIs or SNRIs due to serotonin syndrome. And caution should be taken in patients with PKU as orally disintegrating tablets contain phenylalanine. Adverse drug reactions are prolonged QT when used with other QT prolonging medications. And it can definitely cause serotonin syndrome when you use it with SSRIs or SNRIs. So you need to be very cautious of that. The drug interactions are apomorphine, which is used in patients suffering from Parkinson's disease, and it may cause a decreased level of consciousness and hypotension. Of course, the clinical indications in use are the prevention of chemotherapy-induced nausea and vomiting and postoperative nausea and vomiting. Monitoring and precautions for these drugs, you want to obtain a baseline EKG in at-risk populations. So, for example, those patients with a history of congenital long QT syndrome, ventricular arrhythmias, cardiac disease, electrolyte abnormalities, or those who are receiving cardiotoxic chemotherapy. Monitor your electrolytes as well. Monitor for signs and symptoms of serotonin syndrome in patients who may use SSRIs or SNRIs, lithium, fentanyl, or meprazine. Signs and symptoms include mental status changes, autonomic instability, neuromuscular changes, GI symptoms, and or seizures. Constipation is commonly reported, especially in the use of extended release sub-Q injections. This can be compounded during pregnancy or in patient populations at risk for complications. Patient education. You want to take this medication as directed. Don't exceed the dosing limits. And the lifestyle management, you don't want to drink alcohol with it, and you want to see how the drug affects you before you drive or operate any heavy machinery. So my main takeaway for this drug, don't prescribe it to somebody with a prolonged QT or other drugs that prolong your QT. 2, be very cautious when prescribing with patients with SSRI and SNRI for possible serotonin syndrome. And 3, Zofran is a pregnancy category C. Thank you so much, and here's a word from our sponsor. Go.
Nurse, I think I feel sick.
Oh, don't worry. Let me get some of that don't puke on my boots juice. Here, I got you.
I feel so much better, thank you.
I am so